The following information is intended for educational purposes only. It is not medical advice. The views expressed do not reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.
Perhaps you've heard the fact that periodontal disease can lead to heart disease, but have you heard that 5 of the top 10 killer diseases in America also start with periodontal disease, and over 80% of Americans have some form of disease in the mouth? So what do we do about this? Heather, the hygienist, has been a certified biological dental hygienist and a certified registered dental hygienist for 27 years. She has figured out a secret, and she's about to give you a health awakening. And welcome to the Health Awakening. I'm Scott Laird. You heard right. 5 of the top 10 killer diseases in America start with diseases in the mouth. And not only that, nearly 40% of the bacteria clogging our arteries also comes from our mouth. So what are we doing wrong? Well, today we're going to get some innovative answers from a woman who has been a dental hygienist for 27 years and developed a unique solution, literally, to help with just that. So Heather, the hygienist, welcome to the Health Awakening.
Thank you so much. I'm so happy to be here. I'm just really excited to share a topic I'm very passionate about.
Well, we're very happy to have you here. And we know you have an amazing story, but we're going to save that for the michaelrood.tv app. So we'll have that as a little bonus there. And we want to get right into the issues we're talking about today because you're the expert on these. So tell us, what causes periodontal disease, and how does it affect the whole body? Well, why doesn't it just stay in the mouth?
Well, I mean, that is such an excellent question. And I really am passionate about teaching people how the mouth is really the portal to your overall health. I mean, if you think about it, we have one tube, it starts in our mouth and it goes all the way out us, right? So your mouth is the most vascular part of your body. That's why if you stuck a nitroglycerin tablet underneath your tongue, it bypasses the GI tract and goes directly to your heart. Well, so does all that bacteria. There are no fences in your body. Your teeth are living organs and they poop every single day. So that's why it's so important. The first thing that you do in the morning, please go brush your teeth because you want to get rid of all of that bacteria that has accumulated over the night and brush your teeth first thing. But there are many causes to periodontal disease. Some of them being, of course, neglect, which unfortunately like 100 million Americans don't go to the dentist every year, which is really tragic. But neglect is really big. Smoking, vaping, overcrowding, malocclusion of the teeth, having a dry mouth, which can sometimes be related from medications or mouth breathing. Clenching and grinding your teeth is also another reason that can create periodontal disease. But there are also underlying health conditions that kind of go unnoticed. Sometimes diabetes, your body is not able to fight off the bacteria as well. Also MTHFR mutations, oxalate toxicity, and underlying bacterial infections, which if you think about it, if you've got a bacterial infection inside your mouth, how close is that to your brain and your carotid artery? And again, there's no fence in our body. So all of this bacteria is going to affect us. But people are not aware that, plaque is just something that our saliva produces. It's sticky. It takes really 3 to 5 minutes with a manual soft toothbrush to brush it off the teeth, and 2 minutes with an electric toothbrush. But that is only going to remove maybe 60% of that bacteria, Scott, that is on the teeth. You have a space between your tooth and your gum. And that space is called the sulcus. So a dental professional is going to take a little ruler and we're going to measure that space to make sure that it's healthy. And a healthy pocket is 1, 2, or 3 millimeters. 4 means like you have gingivitis. 5 is a red flashing light that, okay, your bone is rotting. That's the difference between gingivitis and periodontal disease. So, the bone right here, our jawbone, this is our foundation. Just like a house has a foundation, our teeth have a foundation, and it's our bone, but our gums can get inflamed. That is called gingivitis. completely reversible because your bone is healthy. But if you let that progress, if you let that bacteria, that plaque bacteria harden underneath your gum tissue, now it's called tartar, and it's like getting a splinter stuck underneath the skin. So it's going to cause inflammation. So that inflammation in gingivitis is reversible. But if you let it progress, it can start to rot the bone. And you would think that that would hurt, right? Rotting bone, head rot, but it doesn't, because your bone has no feeling, it has no nerves. So you're not going to notice that you have this condition really going on, because it's not painful. Just like with a tooth that has a cavity, enamel has no feeling. So you'll never feel a cavity when it's in the enamel. Only when it gets into the nerve of the tooth do you realize that, oh my gosh, I'm in pain. What's wrong? Let me go to the dentist. And instead of being a $300 filling, it's a $3,000 problem because you didn't get the treatment while it was, cheap and affordable. You waited too long. And so we really are trying to get people to understand you don't want to wait. Your mouth is really where true health starts.
So speaking of things you don't see coming and waiting too long, so I hear you say, plaque of the mouth, and of course people think, oh, arterial plaque, and then, cataracts are also related to that. Is there, and then Alzheimer's has plaque in the brain. Are we talking about all the same thing here?
So they did do a really interesting case study last year, I believe. The preliminary results were released, and they are showing the causative effect of Alzheimer's disease coming from the PG bacteria in the mouth. You have 11 microbes that cause periodontal disease. And the PG bacteria is one of the most difficult bugs to get rid of. I can't pronounce it. It's like, 22 letters long, but it's the PG bacteria and also the AA bacteria. Those are the two most difficult microbes to treat in gum disease. But yes, if we can find out early that someone who, say, has this history, like their mom and their dad and their whole family has periodontal disease, why aren't we doing a culture to see whether or not they have these bugs that are causing that and treat it early before it becomes a problem?
Good question. Well, hold that thought. We're going to come back with more from Heather the Hygienist. You're watching The Health Awakening. We'll be right back. Stay with us. Welcome back to The Health Awakening. Before the break, we were talking with our guest, Heather the Hygienist, about how Alzheimer's is related to bacteria in your mouth. And of course, Heather, we want to make sure that doesn't happen. And you mentioned that sometimes we don't see these things coming, but what can we look for? What are the signs and symptoms of gum disease so we can avoid such things?
Well, some of the symptoms would be like red gums that are tender or swollen, bleeding. Anytime you get bleeding, Scott, either when you brush or floss, that is a sign of infection. I mean, if I touched you on your arm and your arm started to bleed, something is wrong. It is not normal, okay? Loose gums, loose teeth, that's also a sign. Sensitivity that is not explained. A lot of times what happens is, yes, you can get a little bit of root exposure, and when you take in that deep breath, you can feel the cold or whatever, but there's a sensitivity that, really is achy when you have gum disease. And of course, bad breath, which I call death breath, because it's just, it literally smells like a dead body in your mouth. But those are really the signs to look for.
Okay. And when we want to treat these things, I know you mentioned before in the first segment that, we have one mouth and it goes all the way through to the end. And so obviously that's going to, what we put in our mouth is specifically the dental products. That's going to affect everything along the way too, right? I mean, would what we put in our mouth as far as brushing our teeth with what kind of toothpaste, is that going to affect our gut bacteria?
Yes, I'm so glad you brought this up, because I want to teach people that there is not just a gut biome, but there is an oral microbiome of about 700 different bacteria, both good and bad. But what can happen when you have disease going on is that those bad bugs overtake the good. So now you are not in symbiosis anymore. Now you are in active infection, active disease. And our pH of our mouth, you being a naturopathic doctor, you are very familiar with the fact that we need to stay more alkaline. If you drop below a certain pH, that is when disease can come in. Well, if your saliva drops below like a 5.5, that's how you get a cavity. So pretty much, I would say 90% of the commercial products out there on the market, it's like swishing with acid. Listerine, I think, has like a 4.5 pH. And so what you're doing is you're disrupting your oral microbiome. You want to be thinking of how I can alkaline my mouth and your body. You know, again, our body is a temple. Whatever you stick into it, I mean, if you put garbage in, you're going to get garbage out. It's that old adage. But feeding your body the greens, the nutrients, you know, our food is so depleted of minerals and vitamins that we need to stay healthy. And in my book, Dentistry for Dummies, it's a ebook, $10. And I talk about the things that you need supplement wise, because if you give your body what it needs, it always tries to heal itself by design. I mean, that's the way God made us, right? But unfortunately, we are using products that contain chemicals, fluoride. I know that this is a really huge debated topic, but it's a pesticide. It's a mutagen. It's a halogen, known carcinogen. Why are we putting it in our mouth twice a day? I mean, it's unnecessary. It's antiquated. We've come up with nanohydroxyapatite and have been using it for years. It's way more effective than fluoride, and it's non-toxic because it's bioavailable to your enamel. So using products that are natural, become a label reader. Some of the stuff in your oral care products, if you go look it up on the MSDS sheet, it's really shocking, like cetylpyridium chloride. That's also a pesticide. Why are we putting that in our oral care products?
Well, it's the same thing when we take medications, like when we have a cold or a flu or something like that, whether it's bacterial or viral, we choose different products. In our house, we choose to use oregano oil for viruses and colloidal silver for bacteria. Now, so that brings up an interesting point. So with the bacteria in the mouth, what relationship does that have to colloidal silver, and can we use it for anything?
So I love colloidal silver because colloidal silver only kills the bad bugs, not the good. So it is not going to affect your oral microbiome. And that is really, really important. Like if you were to use Listerine with the alcohol, it's 27% alcohol. And again, if you go and you look at that MSDS sheet, it will tell you under toxicity that it can cause throat and mouth cancer. It's because you're disrupting that oral microbiome. So the colloidal silver is a fantastic base because it is just going to kill the bad bugs. It's not going to affect any of the good. So it's naturally pH balanced, and it's just, it's completely safe. So it's not something that is going to cause you any harm. You're not drinking my mouthwash, okay? We are talking oral care products, but I do want to let people know that the reason why they're allowed to put these kind of chemicals in oral care products is because they're considered cosmetics. So that is why you can have some really not so great ingredients in your commercial products today, unfortunately.
So in addition, so someone might see this and go, great, well, so full disclosure here, you have products that include colloidal silver. That's what got my attention. That's why I wanted to ask that. So someone might say that, well, why can't I just swish some colloidal silver I've made at home? What's the difference between this and what you have?
Well, okay. First of all, on my quest to become more healthy, I really started looking into the ingredients in oral care products and was kind of disturbed when I went to the health food store, even, something that's so-called healthy, and looking at the ingredients, I'm like, that isn't healthy. Why on earth would I want to stick that into my mouth? I mean, personally, I'm a naturalist. I don't want to put chemicals on my skin. I don't want to eat them, and I certainly don't want them in my oral care products. So I actually read a proverb every single day. And one day I was reading Proverbs 8:12, which says, I wisdom dwell with prudence and give knowledge of witty inventions. And I asked God for a witty invention that day, but oh my gosh, probably a year went by before one day I'm standing in front of my fridge and God just downloaded the ingredients to Simply Silver mouthwash into my brain. Like, I don't know how else to describe it, just like a download. So I was so excited. I ran over to the computer and I started Googling all of these ingredients, and there was nothing else on the market like it. And Simply Silver mouthwash literally has ingredients in there that no other mouthwash has. And
well,
it's
hold
just
that thought.
great.
Let's get into that in a second here. We got to take a break, but we'll be right back. We'll find out more about this amazing mouthwash. I want to find out about it because we try and use the best stuff in our house, but this sounds even better. So we're going to come back with Heather the Hygienist. We're talking about oral care products, specifically ones that include colloidal silver. So we'll be back with more from the Health Awakening. Stay with us. Welcome back to the Health Awakening. Before the break, we were talking with Heather the Hygienist about this colloidal silver mouthwash. Heather, tell us more.
Well, it is unlike any other product on the market. I use, I know it sounds weird. It's dragon's blood, right? It sounds so strange, but it's from Peru's dragon tree, and it's the sap. So what the sap does, like if you were to cut yourself, Scott, and you put this sap on your skin, it's like a liquid Band-Aid. So it's a natural coagulant. So I have the sap in there. I have CoQ10, which science has shown that if you are lacking CoQ10 in your body, you are probably going to have periodontal disease. So that's why it's so important that you supplement with CoQ10, because it helps your body fight off this bacteria on a microcellular level. So there's CoQ10 in there, essential oils, myrrh, that has been, around for thousands of years. And then I have tea tree and clove in there. So just the whole combination is really just an amazing synergistic effect of killing the bad bugs and not the good. And I have two lines. I have my original mint and cinnamon, but then I recently just launched my nano hydroxyapatite line because I want people to have a natural alternative to your fluoride commercial mouthwashes out there. For little kids, they're promoting ACT. Well, have you seen the ingredients on that? It's like cancer in a bottle, and here we are giving it to our kids. So I wanted to come up with something that was kid friendly. It's a very mild flavor spearmint, and it has the nanohydroxyapatite in there, which NASA has been using for years to build their astronauts' bone back from being in anti-gravity situations. And Japan has been using it since the 80s as their gold standard. So I wanted to have products that were clean and green, but also effective, because when you use something, you want to have fresh breath. You're using it for a purpose, not just for just the fun of it. You actually want it to do something. And I wanted to address the issues that I was hearing from my patients on a daily basis about, my gums are bleeding, even though I'm still flossing. My teeth are sensitive, even though I'm using Sensodyne. And, all of these issues that I feel were not being addressed, that my lines do, really help people with their issues. So I'm really happy that, God has given me the ability to create this really out of my kitchen. I'm not a chemist. So this all came about with me and my KitchenAid. So, God really does have quite a sense of humor.
Really cool. I love it. So the main question I want to ask is, okay, if someone already has gum disease, we're using these products, we can sort of halt it perhaps, or prevent it from happening. But when somebody already has gum disease, how do we take care of this?
Well, getting to the root cause is always the most important thing, because, a lot of the times it is neglect. It's so super frustrating as a clinician, to hear someone come in to my chair and I ask them, when was the last time you had your teeth cleaned? And it's 5 years, 10 years. And then they get upset that now they're looking at a $15,000 treatment plan because that neglect was so extensive. It's kind of like, if you had a vehicle and you never got your oil changed, you're going to blow the engine, right? And that's going to be an expensive repair, but you can't get mad at the dentist when we present a treatment plan because of neglect. So neglect is the number one thing. Also, people are not aware of the importance of flossing underneath your gum. Please throw away those little floss picks. I call them cheaters. Okay, they do not go underneath your gum tissue. The whole purpose of flossing is to go underneath that space. Manual floss can go 4 millimeters in depth. Those little cheaters, 1 or 2. Okay, you just cannot get it underneath the gum. So you do need to use manual floss. You need to have a water pick. If you want to keep your teeth and you've got periodontal disease, you have to have a water pick. There's just no way around it. You need to be seeing your dentist probably 4 times a year. If you're a plaque producer, because people tend to fit into one of 2 categories. Either they're very cavity prone and they don't have gum disease, or they are plaque producers and they, build tartar like no one's business. So, for myself, I've never had a cavity, but I am a plaque producer. So I get my teeth cleaned 3-4 times a year myself. So you want to make sure that you're getting regular dental visits. You find out the root cause. Testing, get a bacteria culture done. We have the Hain testing now. We've got the oral DNA. We've got bristle health. You can go on my website actually, and these tests are available to you. Okay, so I am a provider for some of these tests because I want to help people get to the root cause. If you have a diagnosis, that is what helps you, whether it be supplementation, changes in your diet, or changes in your home care, we can get to the root cause. So really finding out what that is, but you have to see the dentist. I mean, that is just an essential part of it.
Okay, well, we'll talk more about how to do that and how to get in contact with you in just a second. We're talking with Heather, the hygienist. We'll be back with more from the Health Awakening. Stay with us. And welcome back to the Health Awakening. Thank you very much to Heather, the hygienist, for joining us today. And Heather, we want people to go to your website, find out all kinds of information that you have, and start getting the stuff you have. Where can they do all of that?
Well, they can visit my website, which is www.simplysilvermouthwash.com. And you can get my ebook. Like I said, it's only $10. There's lots of great information in there. I really want people to be their own health advocate. So please feel free to check out my blogs. I've got a lot of information that they can read for free, but everything is available online. I'm also on Amazon, but it's great to have the actual business come in through my website.
Absolutely. Okay, well, thanks again for joining us. And we're going to share your story, your personal story, on the MichaelRood.tv app. So we'll see you there as well. And we'll see you again for another Health Awakening. Thank you for joining us today on the Health Awakening. You can catch the replay of this episode and see our complete show archive at healthawakening.tv. For more information about our guests today and all they have to offer, please visit their website on the bottom of your screen. And please remember, the information you saw today is intended for educational purposes only. It is not medical advice, nor do the views expressed reflect those of this broadcaster. Should you choose to implement this information, please do so only with the assistance of a licensed medical professional. Neither the presenter nor this broadcaster assume any responsibility for any adverse effects or consequences that may result.